X2thel, of course, is interested in more than music. We're interested in your music, but we're also interested in your life and your way. And so a big part of what we're trying to do is is connected to the lifestyle, okay? And we are very pleased this evening to have Dr. Leon Merrick with us, okay, who is a health professional, and we're going to get into his practice in a moment. But before we do, there are a couple of statistics that I took note of, and they're actually, I guess, very disturbing to me. The Centers for Disease Control and Prevention has done a study on the health of Black or African American non-Hispanic people in this country, and they've compiled statistics saying that 13.9% of African Americans of all ages are in fair or poor health. 38% of men who are 20 years of age or older are obese in our community. 54% of women who are age 20 and over are obese in our community. The percentage of men in our community age 20 and over with hypertension is 37%, and the percentage of women age 20 or over with hypertension is 44% in our community. And so, as you might imagine, that leads to high rates of mortality, and the leading causes of death in our community is heart disease, cancer, and stroke. And so it turns out, apparently, that poverty is bad for your health. And when we talk about poverty in this country, we talk about race, because over 50% of Black and Latino young adults live in poverty, compared with less than 30% of white young adults. And so the effect of poverty on health has been clearly documented, and people who live in poverty are more likely to have asthma and diabetes. They're 5 times more likely to be exposed to lead paint as children. They're twice as likely to have untreated cavities, which can lead to heart disease or infection and even death. Well, when I read that, then I knew I had to talk to Dr. Merrick, okay, because a lot of us are familiar with some of the maladies that plague our community. We know about obesity, we know about diabetes, but heart disease resulting from poor oral health was a new one for me. And so that's what we'd like to talk to you about. And maybe you can, shed some light on this and tie this into your practice.
All right. Well, good evening. My name is Leon Merrick. I'm a dentist in the Harlem community. And as Brother Colley was saying, we have a multitude of illnesses that plague our community. And some of the illnesses stem from our lifestyle, our habits. For example, you mentioned high blood pressure, diabetes, things like that. When we were slaves back in the cotton patch, we would work off those high-calorie, high-fat meals. We just burn it up. However, things have changed. Now we live a more sedentary existence. We don't burn up those calories, even though soul food tastes good, smells good. We eat it more than we should, frequency-wise. But what happens, because we don't exercise, because our kids, when you look at them now, you say, Johnny, go outside and play. Johnny says, oh, Ma, do I have to? It's almost like punishment. But when I grew up, my mom said, son, you have to stay in the house. It was punishment for me that I couldn't go out in the street and run with my boys. So things have changed. And now the kids have specialized thumbs to play with those games. But what happens is they're still eating those high-calorie, high-fat meals, and it's affecting them adversely. I think this is the first generation, the kids who are coming along now, who are not going to outlive their parents. Just because they start out with diabetes and heart attacks and all those other things at an earlier age.
Well, I think that soul food, in some cases, may be a likely culprit. But I also think that, especially when you're dealing with younger people, that fast food is probably the biggest culprit, because you very seldom see someone getting, like, you know, a soul food, you know, breakfast burrito, okay, or a soul food Happy Meal, if you will, okay. But the fast food companies start advertising at night to get you souped up for the breakfast that they want to sell you in the morning. And in fact, I knew that we were in trouble when, and I'm not going to name the name of the chain, you know, and I'm sure they're very fine people, okay. But when I realized that they had a character, and they would do an entire commercial on this character and how you would go to their restaurant because this is where the character was, and some of his, you know, playmates or what have you, okay, and you wouldn't see any reference to food. They wouldn't show you a burger, wouldn't show you a fry or shake, but it would show you this, like, you know, happy person dancing around, okay. And I'm like, well, fine. Now they're so sophisticated that they can install this notion into your mind that you need this product without even showing you what the product is. Well, one thing that I found, like I said, I read this about oral health and heart disease, so I did a little more research. And as it turns out, heart disease, of course, is the leading cause of death in the United States, and 27% of all the people that died in the United States, well, this is back in 2005, 27% of people that died in the U.S. Died from heart disease, and coronary heart disease, you know, resulted in 68% of those deaths. And so there are studies that indicate that gum disease is associated with heart disease, and chronic help me pronounce it.
Periodontal.
Thank you. Is an independent risk factor for coronary artery disease. And I guess what this is saying is that oral infections result in systemic exposure to pathogenic oral bacteria and increased levels of inflammatory markers, which could contribute to this heart disease. Tell us about that. How does this work?
Man, everything in the body is interrelated and interconnected. The stuff we put in our mouths affects us adversely. For example, you were mentioning fast foods. The structure, the way the system is set up, you can get $1 meal and it'll have 600 calories. And of course, the little things that you're going to eat for breakfast, one's not enough, so you'll order two. So for $2, you have 1,200 calories, which is basically half of
what you're supposed to consume that day.
Exactly.
But you're not even done.
Right. But on the other hand, if you went to get a chicken salad, it would be $4. So when you look at a $4 salad versus a biscuit with some cheese and some bacon on it, one tastes much better than the other. But it has a deleterious effect on the body. Then the other thing that happens is we eliminate a lot of our minerals through our saliva glands in the mouth. So if we don't brush our teeth at night, say we go to sleep, we're tired, we don't brush our teeth, the food called plaque is still stuck on the teeth. And what happens, the minerals come out of the saliva and get stuck on the back of that food. And it mineralizes, turns to a stone. That's why we need a hygienist to come along and have a special machine to actually buzz it off like a jackhammer. So, but what happens, that stuff called tartar, it wreaks havoc on the body. Whatever it touches, it destroys. So, it gets on the back of the teeth. It touches the gums. All of a sudden, the gums start pulling back, and the teeth seem to get longer and longer. It's called recession. Your gums recede. But then what happens, it only recedes to a certain point, and then it touches the bone. When it touches the bone, the same thing happens. It's like an industrial poison. The bone starts pulling away to get away from the tartar. And as it goes further and further down the tooth loses support, it gets loose and falls out. But in the meantime, the gums bleed because they're ulcerated. They form little ulcers, little openings where bacteria gets in and it gets into your bloodstream. And it like heart valves as a delicacy. So it'll nip away at the heart valves. And of course, now when the heart valve is closing, it'll crush a blood cell or two. And that'll start the clotting factor. And that's how you get these heart attacks and strokes. You get these clots that are floating around the body, and then they get stuck in these little arteries called arterioles, and it blocks it off. And whatever's on the other side that can't get nutrition, say your eye, and all of a sudden you start to get blindness. If it stops in your kidney starts to fail. It's bad news.
And all of this comes from just poor oral health.
Poor oral health and poor diet. It's always a combination.
So why is it that people aren't talking more about this in our community? Why is it that, you know, you don't hear about this all the time? Like you hear about obesity and you hear about diabetes.
I don't know why, but it doesn't happen.
I know that, you know, not to step on your sentence, but I know that you're doing your part. You were at the Circle of Sisters event at the Javits Center this weekend.
Absolutely.
Which you're to be applauded for being involved in that, especially given the fact that I know that you were doing double duty at your church throughout the weekend. Okay, so for you, you were actually operating your medical practice, being at an event that was touching a whole lot of black people, and then at an event that touched even more black people. And so we appreciate that. One thing I want to ask you about though, okay, and we're talking about poverty. And there's, I guess, disparities in oral health across, you know, various populations in the United States. And so it turned out that apparently non-Hispanic black people, Hispanics, Native Americans, and Alaska Natives have the poorest oral health of any racial and ethnic group in the United States. And the greatest racial and ethnic disparity among children aged 2 to 4 years and aged 6 to 8 years is found in the Mexican American and African American non-Hispanic children. And that blacks, non-Hispanics, and Mexican Americans between the ages of 35 and 44 years old experience untreated tooth decay at a rate of nearly twice as much as white non-Hispanics. I would at first blush attribute that to, you know, the fact that our income is, you know, not the same and never has been the same since since slavery, you know, and up into the, you know, the 21st century. What is there that we can, is there anything that we can do about this? I mean, is it the fact that like people don't have dental insurance? Is that the reason why? Or is it, is getting, you know, dental treatment cost prohibitive? Or, you know, what do you say about that?
Well, again, this is, this issue has multiple facets to it. Usually people have what's called, it's a disease that's not written in the textbooks. It's called PBEs, previous bad experiences. And a lot of folk have previous bad experiences because they don't have the money to go to a quality dentist. They'll go to a clinic. And a clinic, of course, is rushing, and you know, they're trying to make a certain quota of visits per day. So the time is not spent on the patient educating the patient as to how to brush, how to floss, how to eat properly. So they just become emergency visits. And of course, since time and money are involved, then the caring isn't there. So when the caring's not there, the patient gets scarred. And that's how PBEs get started. And PBEs, once your mind says, oh my God, I hate that experience, they didn't get my tooth numb, they held me down, then one doesn't go back. And then another thing happens, not only does that person not go back, if they have kids, they don't take the kids unless it's an emergency. There's no preventive care, you know, because right now we have a thing called sealants And when you bring the child in, pre-cavity. They get a cleaning, you ride them up and down in the chair, it's really fun. And then what you do is you place these sealants on the tops of the teeth. And then you bond it on with the blue light. And what happens, it becomes a shield, a barrier between the tooth and the oral environment. So if the kid eats candy and goes to sleep without brushing his teeth, no harm is done because the sugars land on the plastic and not on the tooth.
So it has to be new technology because they didn't have that when I was a kid.
Yeah, that technology must be 20 years old.
Well, I haven't been a kid.
About 25 years.
Yeah, about 25 years or so.
Yeah. So there are ways to handle it, but because the parent has been traumatized, they don't bring the kids in for preventive care. So it becomes emergency care all the time, or frequently. And it takes a wise parent to be able to break that barrier for the child, even though they are fearful for themselves. And I think that's how it works.
Well, thank you for sharing your time with us. We really appreciate it, and we look forward to chatting with you again. And you might want to tell us where we can find your own dental practice.
Right. I'm located in the middle of Harlem on Strivers Row, and my address is 260 West 139th Street between 7th and 8th Avenue. And we'd love to have you come by. We give you the best of care.
Thank you again, Dr. Merrick.
All right, thank you.